Everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. Am I audible and visible? I hope I'm audible and visible. Please refresh and see. All right, happy evening, everyone. A very good evening. I hope you are doing well and I hope you are on the daily targets, trying to complete your targets. So, we have started with the new timetable for revision for NEET PG 22, even for INICET, and the FMG students can also follow the same timetable. So, I hope the audio visual is good. All right. So we had a cadaveric images quiz just now. So, and it was just 10 questions quiz, the very, very important questions that we had. I hope I'm audible and visible, everyone. All right. So this is the leaderboard that we have here. So congratulations, Sheena, who has topped on the leaderboard. Then we have Sri Lakshmi, and then we have Bujawan. So these are the top three students in the today's cadaveric images quiz. Worry not for some of you who were not able to join. I'll be sharing the link if you want. But anyways, we are discussing the questions, so I don't think you need that. All right. So, starting with the discussion of the top 10 questions without any further delay, and let me tell you what's the plan for tomorrow. Okay, what's the plan for tomorrow? Tomorrow, basically, we are going to have your 7 a.m., 10 a.m., and the 5 p.m., and the 9 p.m. session, right? So, 7 a.m. is your study with me session where you study, I study together, virtual library. 10 a.m. is an academy plus radiology revision. So tomorrow we have a neuro radiology 10 to 12. 5 p.m. is KBMD. Today was fast 5. So tomorrow will be top 10 mnemonics KBMD that we would be having at 5 p.m. And I'll try and include a maximum mnemonics from anatomy tomorrow because that is the target that we have. Okay. And then at 9 p.m. again, we will have anatomy, basically anatomy revision. That is what we would be having at 9 p.m. Okay. So that's the plan for tomorrow. Now, starting with the discussion of the questions, we have 10 questions. Let's quickly discuss this. So, question number 1. The left branch of the structure will travel in which relationship to the bronchi at the hilum of the lung? So what do we see here basically is this is the heart that we are seeing here. You can see the three structures here, the three great vessels which we can see here. Right. So what are we seeing here? We have your SAP, right? From right to left, basically the great vessels that we have are, okay, from right to left, the great vessels that we have. Just give me a minute, not able to. All right. Right, so from right to left, the three vessels that we have related to the heart, remember it is SAP, right? It is SAP, that is superior vena cava, ascending aorta, and the pulmonary artery. So that is what we are seeing here. This is the superior vena cava, this is the ascending aorta, and the pulmonary artery. So the label structure here first is pulmonary artery. Now, this left one, okay, no, 9 p.m. is on the YouTube channel only. I don't know what was the problem with the quiz. कोई नहीं. हाँ तो देखो क्वेश्चन क्यों समझ में नहीं आया तो इसकी जो basically the structure which is labeled here it is pulmonary artery. So the question is saying the left branch of this structure, that is the left branch of the pulmonary artery, will travel in which relationship to the bronchus at the hilum. So basically, what is the relationship of the left pulmonary artery to the left bronchus at the hilum? Does it travel superior? Does it travel inferior, anterior, or posterior? Okay. So basically remember this, the left lung hilum and the right lung hilum. You have these structures that you need to remember. How is the relation? The left pulmonary artery you can see is related superior. It is related superior to the bronchus, right? The pulmonary artery, right? That's the pulmonary artery carrying oxygenated blood or deoxygenated blood. It is your deoxygenated blood from the right side of the heart. Now here at the right lung hilum, you can see that this is the bronchus and the pulmonary artery located anterior to the bronchus. The right one is anterior. Yes, this video will be saved. Don't worry. So basically remember this with the mnemonic, it is last, okay, it is last and it is Raat. Okay, so basically the last night, that is the last Raat, right? That is what you can remember here. So remember that the left artery is superior to the bronchus. The right artery is anterior to the bronchus. Okay, the right artery is anterior. The left artery is superior. So remember the last Raat, right? The last Raat before the exam. Please revise this. So this is your pulmonary artery. Left is superior, right is anterior to the bronchus. That is the relation that you need to know. Okay, that's the relation that you need to know. So can you tell me what is the radiological application of this? Now in the chest x-ray, can you tell me the left hilum versus the right hilum? Which one is superior? Which one is located at a higher level? It is the left hilum which is superior to the right hilum. So in the chest x-ray, all right, so in the chest x-ray, you have the right hilum, you have the left hilum. The left is superior to the right. If the right goes superior or if it is at the level of left, it is abnormal. It can happen like in TB, which is pulling the hilum towards itself. Remember that the left hilum is superior. Okay, the left hilum is superior. Okay, so this is pulmonary artery, ascending aorta, superior vena cava. You can see the brachiocephalic vein, the right and the left. Okay, so that's your brachiocephalic vein we saw in KBMD today. Okay, now going to the next question here. Identify this muscle. There was this sort of question in the recent INICET exam as well. Identify this muscle here. Now this muscle is the answer here is gluteus maximus, right? It is your gluteus maximus. Why? Because you can see that this is the muscle which is majorly located here in the buttock, the gluteal region, and it has this origin from the sacrum also, right? It is this entire muscle here. It's a big bulky muscle having the origin from the sacrum. Let us see the images. So this is the sacrum. You can see this muscle here. This is the gluteus maximus. Beneath this, from your iliac crest here, you have the gluteus medius, and beneath that is your gluteus minimus. Now when that is removed, the gluteus medius, the another muscle you can see originating from the sacrum and going to the greater trochanter along with your medius and minimus is the piriformis muscle, right? That is your piriformis muscle here, also inserted on the greater trochanter. Okay. Now can you tell me the actions of piriformis muscle? What are the actions of piriformis muscle? Piriformis is abductor. Okay, it is abductor and predominantly it is the lateral rotator. It can act as medial rotator also depending on the hip position. But remember, it is your abductor and predominantly lateral rotator, that is piriformis. Importance, superior to that, superior gluteal artery and the superior gluteal nerve. Inferior to that is your inferior gluteal nerve. Okay, so that is about these muscles. So okay, so this muscle here having the origin from sacrum, not inserting on the greater trochanter. Your gluteus medius and minimus inserts on the greater trochanter, gluteus maximus does not, and you can see it's not going there. So the answer here is gluteus maximus. Okay, gluteus maximus. Where does your iliopsoas muscle insert? Where does the iliopsoas muscle insert? The iliopsoas muscle inserts on the lesser trochanter. Remember, that's your lesser trochanter. Okay. All right. Let's go to the next one here. This is the next question. Now, identify the function of the indicated muscle here. Now, based on the options itself, now even if you are not able to identify this muscle, you'll get such image-based questions in the exam. Now, based on the options MCP flexion, PIP flexion, you know that this question is somewhere related to the action of the lumbricals muscle. So indirectly, that's a clue that we are asking about the lumbricals muscle. So this muscle which is labeled here, that is your lumbricals. Now tell me quickly about the lumbricals, whether they are unipinnate or they are bipinnate. What are lumbrical muscles, whether they are unipinnate or they are bipinnate? Look at the lumbrical muscles, 1, 2, 3, 4. 1 and 2. Remember 1 and 2. 1, 2 is unipinnate, 3, 4 is bipinnate. Okay, so these are bipinnate muscles here. These are unipinnate muscles here. Where are they inserting? On the extensor expansion, right? At the radial aspect. Okay, at the radial aspect. What is the function? Remember this lumbricals, you know, you can remember this Babaji ka tullu basically. So this is how the action would be. You have the flexion, right? You have the flexion and you have the extension. So it flexes the metacarpophalangeal joint and it extends the interphalangeal joints. You can make the L also, or Babaji ka tullu basically, to remember. So flexion and extension. What is the nerve supply of the lumbrical muscles? What are these lumbricals supplied by? All by ulnar, all by median, all by radial, or do they have mixed? Do they have a mixed nerve supply? Yes. So remember that when you write lumbricals, remember U and M. So that helps you to remember the nerve supply is by both ulnar and median. Okay, it is ulnar and median both. So ulnar on the ulnar aspect, 3 and 4. Median on the this aspect, the radial aspect, that is 1 and 2. So this is supplied by the median nerve and this is supplied by the ulnar nerve. Okay, this is about your lumbricals. So the action would be MCP flexion and the interphalangeal extension. Question number 3. Going to the next question, question number 4. Again, a question which you can solve strategically, smartly. What is the innervation to this muscle which is shown here? Now, in the leg, in the lower limb, your compartments basically, the anterior compartment, the lateral compartment, and the posterior compartment. Your anterior compartment muscles are supplied by which nerve? The anterior compartment are supplied by the deep peroneal nerve. Lateral compartment is your superficial peroneal nerve and posterior is your tibial nerve. Okay, posterior is your tibial nerve. So remember that is your anterior, right? So anterior deep peroneal, lateral superficial peroneal, and posterior is your tibial. Now this muscle which is marked here, basically it's the anterior compartment. So thinking logically, even if you cannot identify the muscle here, it will be supplied by the deep fibular nerve. Okay, it will be supplied by the deep fibular nerve. That is the deep peroneal nerve, anterior compartment. Now look at the muscles here in the anterior compartment. So anterior compartment of leg, is it the flexor muscles or the extensor muscles? Now, how do we remember it is, compare your upper limb with the lower limb. Okay, compare your upper limb with the lower limb. So, in the upper limb, what is continuous with the palm, this is the flexor compartment. Similarly, imagine that this is the lower limb. You have the sole here. What is continuous with the sole, that is going to be your flexor compartment. So, the continuous with the sole is your posterior compartment. Okay, that's your posterior compartment. So if you have the leg like this and you have the leg like this, continuous with the sole, that is the posterior compartment, will be the flexor compartment. The anterior compartment will be the extensor compartment. Okay, that would be the extensor. What is the nerve supply of your extensor compartment of the upper limb? The nerve supply of the extensor compartment of the upper limb is your radial nerve, right? You have the radial nerve here. What is this autonomous zone of radial nerve? The first web space. So similarly here, in the leg, that is your anterior compartment, the corresponding nerve is your deep peroneal nerve. I'm trying to help you correlate this and remember this. That deep peroneal nerve is where you have the first web space of the foot, the cutaneous nerve supply basically there. That is your first web space is the deep peroneal nerve. In the upper limb, it is the radial nerve. So deep peroneal nerve corresponds to radial nerve. So anterior compartment, deep peroneal nerve, these are your extensor muscles. How will you identify? The one going to the great toe, that would be your hallucis, right? It is your EHL. The one going to the rest of the digits, that is your EDL. And the one going to the last one, that is your peroneus tertius. The lateral side, fibularis, that is peroneus. And you have tibialis anterior, which basically goes down towards the navicular, right? So it is not going to the great toe. And here, which is just in the foot itself, chota muscle, extensor digitorum brevis, right? Extensor digitorum brevis. So these are the muscles here. Again, to identify, if you are asked what is this muscle, just try and trace it. It is going below into the sole, that is tibialis anterior. The one going towards the great toe would be EHL. The rest of the digits would be EDL. Okay. So this is basically the muscle which you are seeing here. This is your EDL. As I said, not really important to identify in this image what is this muscle, but to think logically that anterior compartment, this is your extensor compartment. It is supplied by the deep peroneal nerve. Okay, that is how you would identify this. Okay. Going to the next question here. Okay, going to the next question here. All right. Very, very important image, brachial plexus. Which muscles of the upper extremity does the indicated nerve primarily innervate? So what are we seeing here in this brachial plexus? Most important identification is this M pattern. Okay, it is this M pattern. So you can see this M pattern here basically. So when I say the M pattern, so basically this nerve which is right in the middle of M. Okay. This nerve which is right in the middle of M, remember M, that is your median nerve. Okay, that is your median nerve right in the middle of M. So this nerve is going to be median nerve, right, which is marked. And median nerve is your nerve of the flexor compartment of forearm. So it supplies the flexors of the forearm, right, the flexors of the forearm. Extensors of the arm, radial nerve. Flexors of the arm is your musculocutaneous nerve. Extensors of forearm is your radial nerve. And intrinsic muscles of hand, which nerve supplies the intrinsic muscles of the hand? Predominantly supplying the intrinsic muscles of the hand. Which nerve is that? Intrinsic muscles, the musician's nerve, as it is called as musician's nerve, ulnar nerve, right? It is your ulnar nerve. Tell me which pollicis muscle is supplied by the ulnar nerve? Which pollicis muscle is supplied by the ulnar nerve? Abductor pollicis, adductor pollicis, opponens pollicis. Please remember, it is the adductor pollicis. Okay, you can remember this as adductor pollicis is going towards the ulnar side. So it is supplied by the ulnar nerve. Okay, it's supplied by the ulnar nerve. So this is your median nerve. What nerve is this basically? So median nerve has a contribution from lateral cord and the medial cord, both. So the nerve coming from the lateral cord here, this is going to be musculocutaneous nerve, the lateral cord one. The one below that you have, that's going to be your axillary nerve. Okay, and this from the medial cord that you will have, that is the ulnar nerve. Okay, that's the ulnar. Remember, the middle is your median nerve, the lateral is your musculocutaneous nerve, and the medial one is your ulnar nerve. Okay, that is how you'll identify the major nerves of the brachial plexus, the terminal branches basically. Okay, the terminal branches basically, right? So you have musculocutaneous, axillary, median, and ulnar, and the posterior cord will continue down predominantly as the radial nerve, right? The radial nerve. Okay. So look at this one. Basically, what do you have here? The cutaneous supply of the hand, very important. 3.5 fingers, that is your median nerve, right? The 3.5 fingers, you will have your median nerve on the palm. Lateral would be your radial nerve. Okay, so this is the radial nerve dorsally, median nerve in the palm. But please remember that if you are given an image with this nail beds, okay, on the dorsal side, the 3.5 fingers which you see here, that is going to be the median nerve. Okay, very important point to remember. 1.5 finger medially entire is by the ulnar nerve. So please remember the nail tips or the nail beds of the 3.5 fingers is basically your median nerve. Even though it's on the dorsal aspect, still it is your median nerve. Okay, that's your median nerve. Very, very important. All right, let's go to the next question. Question number 6. What is the innervation of the indicated muscle? What is the innervation of the indicated muscle? Give me a minute, just a minute. What happened to the live chat? Yes, that's your suprascapular nerve. Absolutely right. So this, what you see here, basically the posterior aspect of the scapula, this is going to be supraspinatus. Okay, this is going to be supraspinatus. And the supraspinatus is supplied by suprascapular nerve. Okay, it is supplied by the suprascapular nerve. So the answer here would be suprascapular. The muscle which comes here in the below the spine, that is going to be infraspinatus. So even that is supplied by the suprascapular nerve. Okay. What does upper subscapular nerve supply? As the term says, upper subscapular is your subscapularis. Okay, that will be subscapularis. Upper subscapular, that is your subscapularis. Axillary nerve supplies which muscles? Axillary nerve supplies which muscles? Axillary nerve is basically deltoid. Okay, it is deltoid and teres minor. Okay, deltoid and teres minor. Below the infraspinatus, you will have the teres minor. So basically the three rotator cuff muscles here, supraspinatus, infraspinatus, teres minor, all going to the greater tuberosity of the humerus. It is your subscapularis which goes to the lesser tuberosity. Okay. So remember that subscapularis is lesser and the rest of them are at the greater. The three together, supraspinatus, infraspinatus and teres minor, they go to the greater tuberosity. Dorsal scapular nerve supplies which muscles? Dorsal scapular. So dorsal and scapular, basically the muscles which will be attached here to the scapula, medial aspect, levator scapulae, rhomboideus major, rhomboideus minor, right? That is where you will have the dorsal scapular nerve. Okay, the dorsal scapular nerve. Do you remember? Yes, both supply the subscapularis. And do you remember dorsal scapular nerve recently we had discussed is a component of which triangle of the neck? Dorsal scapular nerve is a component of which triangle? The rest of the branches of your brachial plexus are in your subclavian triangle, but this comes in your occipital triangle, right? It goes posteriorly. So that is your occipital triangle, right? Occipital. Thoracodorsal nerve supplies. So you have the thorax and the thoracodorsal nerve. It supplies latissimus dorsi, right? The latissimus dorsi muscle, latissimus dorsi, thoracodorsal nerve. From where does it come? From the posterior cord, right? It comes from the posterior cord of brachial plexus. All right. So this is your supraspinatus. That is, no, it does not come from the roots, Anuja. Anuja, are you getting confused with the branches from the roots? We have the mnemonic, right? What branches come from the roots of brachial plexus? Roots are long and roots go down, right? So you have long and down, right? So that is your long thoracic nerve and the dorsal scapular nerve, right? That comes from the roots if you are saying that. Absolutely. Dorsal scapular is from the roots. Subscapularis nusat will be anterior. From that scapula ka fossa anteriorly, there you have the subscapularis. Rest of them are posterior. Okay. All right. Okay, Anuja. All right. All right. Okay. Let's go to the next question now. These are the muscles that I was basically telling you. So you have supraspinatus, infraspinatus, and you have close to that is the teres minor. Okay, close to that is your teres minor. Look at this anterior aspect, right? This is the anterior aspect. Infraclavicular, you have the coracoid, right? Your INICET question. This is the subscapularis going to the lesser tuberosity. Okay, that is going to lesser tuberosity. Supraspinatus is to your greater tuberosity. Okay, clear? Brachial plexus nerves. Brachial plexus is already discussed in NF100. Please watch that episode. Very, very important. Okay. All right. Let's go to the next one. Identify this muscle here. What do you think is this muscle here? Okay, Aishwarya, I'll soon post a video on that. The triangles and the quadrangles, you need that hashtag mnemonic basically that you have. The upper triangle, the lower triangle, and the quadrilateral space. Okay. Quadrilateral, the quadrangular space basically is the one towards the axilla, contains your axillary nerve. Right. This one, the lower triangle humerus, that's your radial nerve. So that is what you need to remember. Right. This is your flexor digiti minimi brevis, because let's have a look at the schematic images here. In this hypothenar region, the one which is lateral most, okay, the one जो सबसे बाहर है, remember that is the abductor. Okay, that is the abductor outside. Besides that, the one that you have, that is the flexor. And beneath the flexor is the one that is your opponent's digiti minimi. The difference is flexor digiti minimi, where does it go? It goes to your proximal phalanx base. Opponent's digiti minimi goes to your metacarpal. So tell me, what do you think will be this muscle here? Next time, if I give you this muscle. Ayush, yes, where were you in the today's KBMD? Now, what do you think is this muscle here? From where it is arising and where it is going? Trapezium, trapezoid, capitate, hamate. Coming from the hamate, going to the metacarpal. This is your opponent's digiti minimi. If it goes to the proximal phalanx, flexor digiti minimi. The one which is going to be lateral most, that is abductor digiti minimi. So look at this image again. The lateral most abductor digiti minimi. Uske baaju mein you have flexor digiti minimi. Okay, so these are the muscles here. How about the thenar muscles? Okay, how about the thenar muscles here? Let's see those. So in the thenar muscles, remember the ones which is the outermost, that is the opponents. Okay, so remember pollicis, outer aspect pollicis is opponents. Okay, that is opponents. Then you have abductor, then you have flexor. So in the thenar, opponents is the outermost, then you have abductor, and then you have your flexor muscle. Okay, then you have your flexor muscle. Very, very important. So look at this. What muscle will this be? The outermost here. This is your abductor digiti minimi. This outermost on the pollicis aspect, that is your opponent's pollicis, abductor pollicis, and flexor pollicis. Okay, that's your flexor pollicis. And these muscles which you see here, these are the lumbricals originating from the tendon of FDP, right? Those are the lumbrical muscles there. Again, look at this muscles. Thenar aspect, you have outermost pollicis, opponents, then you have abductor, then you have flexor. Okay, here it would be abductor and flexor. Look at the cadaveric image here. What happened? Just give me a minute. Okay. So this one on the outermost aspect that you have, that is going to be abductor digiti minimi. Adjacent to that is going to be your flexor digiti minimi. I hope everybody is clear with this. So the outermost your opponent's pollicis, abductor pollicis, and then you have flexor pollicis. Okay, that is what we need to remember here. Okay, that is what we need to remember here. Okay. So going back to the image that was asked, so this muscle will be abductor digiti minimi. and the muscle adjacent to that will be your flexor digiti minimi. Okay, that is your flexor digiti minimi. All right. So this was your question number 7. Going to question number 8. Very, very important. Which of the following muscles is not supplied by the structure marked? The structure marked here is basically your loop of the nerve, that is Ansa cervicalis. Okay, that is your Ansa cervicalis. And what does your Ansa cervicalis supply? Basically the neck muscles, the strap muscles. What it does not supply? Okay, what does it not supply? Lateral most is opponents in both? No. Lateral most is abductor here in your the little finger side basically. Yes. Which are the two muscles which are not supplied by the Ansa cervicalis? Two muscles not supplied by the Ansa cervicalis. One is geniohyoid and one is thyrohyoid. Okay, geniohyoid and thyrohyoid. So, yes. How will you remember this? Remember Ansa. Ansa is your sternovala muscles are supplied. Sternothyroid, sternohyoid are supplied. And remember AN, it is also your inferior belly of homohyoid. Okay, the belly of homohyoid. So remember the geniohyoid and the thyrohyoid are not supplied by Ansa cervicalis. What do you think is this structure here basically? What do you think is this structure here? Anyone? What is this structure which I'm showing you here? What is this? What is the labeled structure here? Yes. That's your hypoglossal nerve. Can you see there is some contribution coming from it basically towards the Ansa? Right? So that is your hypoglossal nerve. You can see it's crossing your carotid. It's a component of your carotid triangle as well. Right? The carotid triangle. So this is the hypoglossal going towards your submandibular, going towards the tongue. That's your hypoglossal nerve. Okay, remember that's your, this one is basically your hypoglossal nerve. All right. So this is what is labeled here. This is the hypoglossal nerve. You have the superior root and then you have the inferior root basically Ansa cervicalis. Okay. And this muscle here is your omohyoid going to the hyoid and coming from the scapula, omohyoid. Okay. Next one, let's go to the next question. Okay. Lateral rectus is supplied by nerve marked as which of the following? Lateral rectus is supplied by nerve marked as which of the following? So we know that lateral rectus is LR6. Okay, it is LR6. LR6, how will you identify the sixth cranial nerve? Very, very important. Which are the cranial nerves arising from medial aspect of the brain stem? In whichever number table you have 12 which comes, right? 3 4s are 12, 4 3s are 12. So 3 4, 5 12 does not come, 6 12 comes in the table, 7 8 9 10 12 does not come, 11 12 does not come, 12, right? So 3 4 6 12 are the nerves which arise medially. Now the next thing that you need to know is which cranial nerves come from the pons. Tell me which cranial nerves come from the pons. Cranial nerves 4 to 7, cranial nerves 3 to 7, 4 to 8, 4 to 9, 5 to 9. Which cranial nerves arise from pons? So basically remember midbrain, pons, medulla. Upper 4, middle 4, lower 4. So you have 5 to 8, 9 to 12 and in the upper 4, cranial nerves 3 and 4. They come from the midbrain. Which of these arises from the dorsal aspect of the midbrain? Only the trochlear nerve. Okay, only the trochlear nerve is the dorsal. Okay, that is dorsal. Remember D, fourth alphabet, that is dorsal, that is your fourth cranial nerve. So out of 5, 6, 7, 8, the one which comes paramedian from the pons, that is basically your sixth cranial nerve. So this bigger structure that you see here, this is the pons, right? This is the pons basically. And this cranial nerve that you are seeing, which will be the sixth cranial nerve basically, because lateral rectus 6 cranial nerve we have to see at the pons. So basically your 6, 7, 8 pontomedullary junction, the one which is paramedian, that is the 6th cranial nerve. Okay, that is your 6th cranial nerve. The lateral one is your 7th and 8th nerve. And this nerve which you see here, that is the thickest cranial nerve that you are seeing here. This is the 5th. So you have 5, 7, 8 laterally. You have 6 cranial nerve coming from the medial aspect. That is how you will identify. Similarly here in the medulla, okay. Option B, आपको trochlear लगा, it's not trochlear, right? Because it is the pons that you are seeing here. Trochlear will be from the midbrain. This is not the midbrain, this is the pons, okay. Now this is basically your optic chiasma, here optic tract, and this is the mammillary bodies. Okay, these are the mammillary bodies. This nerve is your oculomotor nerve, which will come from the midbrain, superior to pons. In the medulla, the cranial nerve arising medially in between the pyramid and the olive, that is your 12th cranial nerve. Rest of them will be here, 9th and 11 will be lateral. This one is your 12th cranial nerve. So remember that the 12th cranial nerve is medial aspect of medulla. So it is not affected in your Wallenberg syndrome, which is a lateral medullary syndrome. So the answer here will be basically B. That is your 6th cranial nerve from the pons, from the medial aspect. Okay, between pyramid and olive, it's your 12th cranial nerve. So look at the image here, the same image. This is the second nerve, optic chiasma, mammillary body, the third nerve, fourth nerve, the slender nerve coming there from the dorsal aspect. You have the 5, 7, 8 lateral from pons, 6 from the medial aspect. You have the 12th cranial nerve medially, and you have 9, 10, 11. Okay, and you have 9, 10, 11. So this is very, very important image. Please remember these cranial nerves. Absolutely important. Okay. Going to the next one, I think this is the last question. Question number 10. Basically, popliteal fossa. Okay, basically popliteal fossa. Now it's already labeled that this is the lateral aspect and this is the medial aspect. So that makes things easy for us to identify the structure. Which of the following is expected in lesion of the marked structure in the popliteal fossa? So basically it's marked on the lateral aspect, and on the lateral aspect, the nerve which is going. Oh. Something happened. हवन करेंगे, right? Am I audible and visible, guys? Just give me a quick nod. I don't know. विली, हाँ विली है, सब है. हाँ, absolutely right. So Chakravarti has made the right diagnosis. So it's basically an indication. चलो जल्दी जल्दी finish करो, and then we'll take a break. चलो, all right. So what are we seeing here? Basically, in this image is lateral aspect. The nerve that you will have, like I told you, in the leg, the lateral aspect is the peroneal nerve. Okay, the lateral aspect is the peroneal nerve. So peroneal is this nerve, right? This is the peroneal nerve. So your sciatic nerve, okay, the sciatic nerve basically divides into the peroneal and the tibial nerve. Okay, the peroneal and the tibial nerve. Okay, nothing else. Yes, something. The peroneal and the tibial nerve. So this is the peroneal nerve, and the mnemonic for your peroneal nerve action is, remember, ped tip, right? It is ped tip. That is, peroneal causes eversion and dorsiflexion. Okay, it causes eversion and dorsiflexion. Tibial nerve is responsible for inversion and plantar flexion. Please remember an exception here, that what muscles cause your inversion? the tibialis anterior compartment that will be supplied by the deep peroneal nerve. Otherwise, the function of peroneal is eversion and dorsiflexion. Remember ped tip. So when the peroneal nerve is gone, what will go? Plantar flexion? No, it is dorsiflexion. Eversion will go, not the inversion, right? Not the ankle reflex. What is the root value of ankle reflex? 1, 2, buckle my shoe. So that is S1, 2. Okay, that is your 1, 2, buckle my shoe. So S1, S2 is the root value. Okay, that is the root value. While peroneal ka, it is not your S1, S2. So this is the peroneal nerve. What is this structure here, guys? This one, is it the popliteal artery? Oh. What structure do you think is this one here? This one in the center. Buckle my shoes is to tell you that where do you buckle your shoes? At the ankle. So that tells you that 1, 2, that was S1, S2 is the root value for ankle reflex. मैं कर रही हूँ, मैंने image भी रखी है, बता दो. What do you think? What tendon is this? What artery is this? What nerve is this? What vein is this? What is this? ये sciatic nerve कैसे होगी? Because you are already seeing the peroneal nerve which has come off. So this is basically the tibial nerve. Okay, this is basically the tibial nerve. So please remember that in the popliteal fossa, the most superficial structure that you have, that is the tibial nerve. What is the deepest structure in the popliteal fossa? In the contents, what is the deepest? Deepest is popliteal vein or popliteal artery? The deepest structure in the popliteal fossa is your popliteal artery, right? That is why it's very difficult to palpate your popliteal artery. Okay, so popliteal artery is the deepest, superficial is the tibial nerve. What muscles are these forming the medial and the lateral border of the popliteal fossa? So look at this, semimembranosus, semitendinosus. So if you are asked to identify these muscles, so you have the medial semimembranosus, semitendinosus. So remember, semi is not sami, it is semi. Okay. So it is your semi or sami is basically medial. Remember, MI is medial. Okay. MI are the medial boundary, the superomedial boundary. So you have this diamond shaped popliteal fossa. Superomedial is your semimembranosus and semitendinosus. The membrane-like semimembranosus, larger one semitendinosus. The lateral one will be your biceps femoris. Okay, that is your biceps femoris on the lateral aspect. And niche would be your gastrocnemius muscle, right? The medial head and the lateral head. Okay, so, so that is your popliteal fossa, and I think yes, that completes the 10 questions in the cadaveric images that we have discussed, right from the upper limb, head and neck, and the thorax and the lower limb, whatever are the most important at least, including the cranial nerves. That is what we had discussed. So that was for today, guys, completing the day 1 of anatomy, the 35 days revision timetable. Tomorrow again, anatomy. I've told you the plan, 7, 10, 5, 9. Okay, I'll keep you updated on the Telegram group if there are any changes in the sessions. Okay. NEET 2021 में नहीं था, INICET में था. The question on your hip muscle, the gluteus medius, that was asked, I believe. Class today at 9, because this is the only class which is going on. We started at 9:30, 9:40. Anuja wants to have a poll. Okay. All right. Ped tip exception once more. Okay, Nuzat. So for the ped tip, right, we said that, just give me a minute. See, ped tip, we said that it is the peroneal nerve which causes the eversion and the dorsiflexion. Tibial nerve causes your inversion and the plantar flexion. Which are the inverters, right? Inversion is caused by which muscles? The tibialis anterior and tibialis posterior. What will be the nerve supply of tibialis anterior? Remember, anterior compartment, it is the deep peroneal nerve. So even though it is your inverter, it's not supplied by the tibial nerve. It is your deep peroneal because it is anterior. Posterior will be your tibial. So that is what was the exception. ठीक है कि tibialis anterior inversion करता है, but it's not supplied by the tibial nerve, right? It is not supplied by the tibial nerve. It is anterior compartment. It will be the deep peroneal nerve. Okay, that is what remember. All right, the link of the group, info of the group already there in the description, everyone. Okay, Dr. Nikita's Radsynapse. Okay, so that was for today, guys. Thank you so much for joining in. I hope you have got a quick revision of the important cadaveric images, brachial plexus, cranial nerves, the upper limb muscles, lower limb muscles, right? So thank you so much for joining in, and goodbye. Take care. Keep studying, keep revising, and keep winning. And yes, good night. Have a good sleep and take good rest. Thank you.